Good afternoon, all. We are part of the last panel discussion for this conference, and we'll try and make it interesting for you. A warm welcome to everybody on the panel. We have a fairly interesting topic for us today, essentially trying to understand the role of healthcare analytics and trying to understand, it's a topic that is talked about a lot. Most people will tell you healthcare analytics is the next big thing, and various companies are trying to either focus on healthcare analytics or trying to take the benefit of healthcare analytics in their businesses. So today we will try and provide you a perspective both from the provider side as well as the user side. So we have Vikram here. Who actually provides healthcare analytics services to clients. And on the other side, from a user perspective, we have Rahul and Mihir, who believe there is a huge potential if they were to get good quality healthcare analytics services. So welcome, everyone. Let me kick off the discussion with maybe Vikram. Okay. Healthcare analytics, and we've seen a lot of this, we've read a lot about it. Internationally, healthcare analytics has been used extensively by providers, by insurance companies, by device manufacturing companies. It's a nascent industry in India. Given that you're one of the service providers in the space, what are the areas where you see opportunity in the country? And let's start with that and we'll move ahead.
Yeah. We personally see a lot of opportunity in pretty much every decision-making segment. Whatever has conventionally been an area where you're facing a lot of competition or areas where you're seeing a lot of data, I'm sure with support of analytics you can deliver better. So insurance is obviously the larger player. Government and public health is another very large segment. Hospitals and providers would selectively be going for it simply because the state of data has to improve, and their investments in, let's put it this way, their investments in marketing talent have not been as much as their investments in clinical talent, and it is worse than the investments in IT talent. So that's been, that's pretty much the summary.
Sure. Rahul, you come from the medical devices industry. In your opinion, what are the areas where healthcare analytics can actually help you grow your business?
So I think first and foremost, I want to take a step back and say that why is healthcare analytics very, very important? Okay. And that applies to almost all these stakeholders in the healthcare industry. So let me start off with a parallel from the airline industry. And about a century back, there was like a 50% probability that an aircraft which took off would finally crash. And from there on, in these 100 years, we have made a significant improvement as far as airline safety is concerned. Now, is the same thing applicable in the healthcare context? And the answer is no. Okay. And how has airline achieved in terms of minimizing the variations in outcomes as compared to the healthcare industry? And the reason for that is very, very simple, that every flight that takes off, I think the data is recorded, the data is analyzed, and in case of an eventuality, the data analytics becomes a source of learning for the airline industry and the community as a whole. Now, you look at decisions in healthcare, they are still to a large extent influenced by an individual choice of a doctor. There's a little bit of a factor of saying that, I invented this, and decisions coming from the gut. Okay. So I think the biggest role of healthcare analytics, as I see it, is in terms of improving healthcare outcomes, and that is possible by minimizing the variations in terms of outcomes that are coming out of healthcare. And like I said, there's a leaf that we can take out of the airline industry and then try to improve on this particular aspect.
That's a brilliant point, Rahul. So if I may add to it, and Mihir, we'd love to hear your thoughts on the point that was raised by Rahul, which is essentially saying how can we use data analytics to improve medical outcomes? You are working in the area of diagnosis and better diagnosis through the devices that your company has innovated on. So where do you see, especially on oncology diagnosis and treatment, healthcare analytics helping you?
So just a quick background on what we do. We help detect breast cancer at an early stage. The device that we've developed is a handheld point-of-care device that can help administer quick and easy, painless breast examination test at the point of care. Now, the role that analytics would play for us are twofold. On one hand, India by and large does not have a robust data registry system that tells the stakeholders what is the level of cancer, particularly breast cancer, in a given region. All we have is a guesstimate, a line drawn based on very few data points along the line. And that's because every cause of death in this country is not recorded, and every hospital or a place where death is announced is not registered into a repository from where you could learn that information. But that is just the eventuality of cancer, and you learn the cause of death. But there are many other data points that somebody like me would be quite interested in, because there are different types of cancers. There are different survival rates attached to those types of cancers, different age groups, risk factors. So the importance of data analytics in creating public healthcare policy in the area that I operate in is quite important. On the other side, on the flip side, is the importance of analytics from a device. How is our device able to better assist the healthcare system with the help of analytics? We've got a couple of projects where we are now screening lakhs of women. And so we have this ability now of gathering a lot of raw material, raw data points, which then need to be fed into a system so that we can come up with insights with the help of analytics. So I think these are the two areas that I find interesting.
Right, perfect. We do some work with hospitals, and one of the areas that we often find a big stumbling block is the quality of data that is today captured by hospitals. You have HIS systems, but especially on the clinical side, and especially when we talk about better medical outcomes, on the clinical side, the quality of data that is getting captured is very weak and very, very poor. Vikram, is that an issue that you have come across with hospitals, and how do you think some of this can be addressed?
Yeah, quality of data is definitely an issue, and the disclaimer being that if it was a perfect data, then accounting could do the job. So two cases, and cleaning up of the insights and other things is part of the job of the analytics. So we had, for example, for CA125 aberrant markers, we would, for one of the cancer chains, when we were driving the insights, it came out that 80% of the people for whom CA125 results were there, okay, had gender listed as male. Now, that is something that you have to catch, and you have to be able to modify it. So I would say in analytics, 40% of the work is data cleanup. Okay. I would say 30% is proper analytics. The rest of it is validation and checking and cross-checking that the insights matter and are going to make money. Second is, and this is not, this is something prevalent on a scale enough to mention, a number of places that we have gone across, and I'm talking of the B plus A minus segments. It was part of the job of the IT head or somebody from the accounts to falsify the data at some period of time. And that was for covering up for taxes or for doctor discounting and all that. So part of our expertise had been in learning the reverse algorithm to bring it back to a clean state, where really a test for HbA1c, if it is got this code, is actually a MRI scan, and ensure that the insights run through that. So that's been, I think, but that's part of the job. You don't, if it was a perfect solution, then you might as well plug in a software and get the results.
Fair point. Fair. One of the other areas that we've seen healthcare analytics being used extensively, and outside the country especially so, has been on marketing solutions for providers as well as for companies. Rahul, in your perspective, looking at growing your business marketing solutions, how do you think analytics could help a company like yours?
All right, so I think, as you may know, that most of the healthcare market development work in a country like India is done by medical devices companies who come along with physicians, providers, etc. So a lot of areas like orthopedic replacements or cardiology, etc. This entire market has been developed by the stakeholders coming together. Now, I think, each of us in an environment where there's continuous pressure on cost is struggling to say that which is the best way to invest the dollar. And it is at this time that the optimal use of the resources that we have becomes very, very important. So the data analytics in terms of saying that which are the areas, which are the pockets in the country, which is that specific geography, which is that specific patient type. Once we have that data, I think the resource optimization can be done in a better way, which essentially means that the development of the market can significantly improve. And here is a great opportunity for the providers and medical devices companies to actually partner in terms of the data. And I think the data needs to, in some way, get integrated or talk to each other, because a lot of people with the early signs will actually land up at an OPD. And that's when I think we can find out what is the right intervention for them. So I think these two areas, which is early detection and also in terms of targeting your marketing messages or communication messages to the right patient subgroup, is something that medical devices companies can hugely benefit from.
Right. Vikram, from a hospital perspective, how can analytics be used for better marketing and for hospitals and driving revenue growth for hospitals?
Yeah, so one, analytics is a decision support science. So practically all your decisions can be validated or supported or even tested before they are rolled out. If you put 5 marketing people in a room, one will say Times of India front page, second will say billboards across the city, third will say newspaper inserts, and fourth will say digital. And the reality is none of them have data. And shifting from a mindset which is a gut feel driven or a brand driven to that yes, this is a trend or a pattern I clearly see and that has been making money and I need to scale that up. 2 is whatever activities are being done, if you have some constraints on it, budget or others, you can always optimize for that. What should be my spend given that I have this much money? How can I maximize my returns and model that in way? The challenge has always been in getting quick results. So wherever we have worked with, I think pretty much everywhere the good and the bad has been that they have worked earlier with and failed on analytics projects. So that allows us to have good that they come in with the right questions and expectations that ye nahi hoga, then we don't want it. And bad that this has got the largest pool of stakeholders to convince. In most other initiatives, you get a buy-in from, let's say, CO or sales or anything, the project is rolled out. Here you have to get a buy-in from the clinician that the algorithms are correct. You have to get a buy-in from IT team that the data is safe and secure. You get to buy-in from procurement and legal that the contracts are strong and valid. You have to get buy-in, and more importantly, it has to be a top-level initiative, which means the CEO or somebody key has to be involved. So those are some of the quick facts.
Fair. So I have to talk about an instance. We were helping a hospital improve its revenue recently. One of the things, and this is building on what you were saying, Vikram, one of the things we thought was, before we spend money on marketing, let's find out how effective have been various channels for marketing. We tried to search for data. We put in place mechanisms to collect this information and this data. And it was amazing when we saw the output, exactly to what you were saying, hoardings versus word of mouth. So everyone said, oh, I heard of this hospital from somewhere, and that's the reason why I've come here. or somebody had a previous experience, we were trying to get data on where patients are coming from. It's impossible to get this information or data in a hospital setting in most cases in India today. And those are the challenges, I think, from a marketing perspective when we look at, or marketing hospital or creating high quality marketing programs based on data that today we are struggling with, and gut feel and intuition and yes, collective experience of people in the room is typically what is used, and therefore you end up saying, yeah, referral cuts are, is something that needs to be done. So you pretty much end up with that answer. Hopefully a lot more data analytics on this field will help us arrive at more interesting solutions on marketing of hospitals. Mihir, trying to understand from you, if you had a good service provider who was able to provide data on demographics, on incidence of the disease and so on, how do you think you could help it in growing your business also? And vice versa, you are collecting a lot of information through, let's say, the device that you're looking at when you're screening patients for cancer. How do you think this information can actually be collected and used by hospitals and other public policy makers to get to better allocate resources for, let's say, cancer treatment?
Yes, I think we are building the Maslow's triangle for data analytics, health data analytics in India. And so we are at the very ground floor level right now where food, shelter, and safety sort of, is the priority. So the field that I'm in, I think if we knew what the burden is of cancer, then we'd be able to prioritize it accordingly. Because we have other pressing matters going everything from Zika to chikungunya and everything in between. So how do you get a healthcare system to prioritize its monies, because it's always finite what you have to spend. And when you're speaking with decision makers, you don't want it to be a gut call, as Vikram said, or you don't want it to be somebody's whims or fancy. You want it to be based on hard evidence. And medicine prides itself on practicing purely on evidence. But it's funny that when it comes to policy making, there is lack of information or data. So you are not able to make those high quality decisions. And the models exist very precisely on how do you collect this and how do you measure it and how do you dashboard it so that the decision makers can react to it. So we are at this nascent stage where it needs to be collected first.
Sure.
And in a couple of meetings where I've had the opportunity to either speak with the government or with private healthcare providers, I've voiced my opinion about how you need to really capture the basic data points, which are not very complicated to capture. And while EHR systems can get quite messy and complicated, some of the data points that I'm talking about are easy to grab. So you don't need to really need an entire IT system overhaul in doing some of these things. I think they can be done more easily. Sure. India has, and this is my 2 cents on what could be done. Please. I think we have an amazing referral network, right? It's almost a social referral network where a GP refers to a specialist and a specialist refers to a hospital. We don't have an electronic referral system, but nonetheless, there is a referral system in place. And so if there was a way to have the referrers log into a system and just tabulate what they've just referred out. Sure. You are getting paid, right? And let's say, there's nothing wrong about you referring a person up, who needs the next level of care. But if that were to get documented, then you have the continuum of care documented. You'll know how many people were worked up who came in with a certain concern. And that's where you'll get the view towards prevalence of cancer.
Yeah, sure. From a public policy perspective, if you look at India, there's a huge shortage of data on epidemiology. So specifically talking of cancer, cancer registry says, the incidence of cancer is 100 per 100,000. We have seen estimates and we ourselves believe that the numbers are much higher than that. So just purely from even even getting to know what is the disease burden of a country. I think we are in the very, very early stages of even trying to understand what is the disease burden. Getting on to more, given the forum and trying to understand how this can be used better from a profit perspective, one of the areas where analytics has helped significantly is on better cost management and optimization of cost. So Rahul, any thoughts on that of how analytics can be used for better cost management?
I think you've touched a raw nerve, because I think nobody is worse impacted without the lack of analytics on the pricing side than the medical device companies, as we face the annual rate negotiation year on year. And I think what typically happens in a rate negotiation is that you sit on the either side of the table, and there is a gut factor of some 20% deflation or something which is applied, and year on year there's an expectation of the price coming down. Not just transpose this to a system where you're actually measuring the outcomes which the devices that have implanted deliver to your patient. How many patients have come back? How many patients have actually got benefited in terms of not having to get readmitted to the hospital, so on and so forth. And then the kind of a pricing model or a procurement model that we come up with is a well-rounded, holistic pricing model. Now, all this is not possible till the time you're actually measuring outcomes, till the time you're actually looking at how your patients are doing after they step out of the hospitals. How devices in the same sort of genre are doing, from the perspective of performing in the patient. So there is a very, I would say, people go for an FDA mark, people go for a CE mark, and then say that, okay, all devices are the same, but it is actually not the same. And in the absence of hard data to substantiate how a device performed, I think annual procurement cycles, just become price-driven negotiations rather than they should be valued negotiations. The other side of this is on how the government fixes the rate for some of the reimbursement schemes like CGHS. And it is a very, it is like a number which is pulled out of thin air to say that, okay, this will be the reimbursement price of this therapy. From a 65,000 rupees, the stent price comes down to 22,500 rupees. Now, if you analyze some of the countries which are more advanced as far as healthcare is concerned, there's a whole lot of data analytics going on in terms of, saying that what have been the outcomes, what is the health economics record, what are some of the leading indicators as far as some of these therapies are concerned. And then you come out with a model which is sort of well accepted by the industry and at the same time allows the industry to make continuous investments in innovation. So I think I definitely see a huge role for analytics in this entire procurement cycle. And combine all this, and we will see a substantial reduction as far as the annual cost of purchase to some of the hospitals is concerned, because then you will be actually talking value and not just price alone.
That came from the heart from Rahul, because clearly he's been on the side that gets impacted with all of the procurement decisions that are being made by hospitals. From the other perspective, Vikram, have you been able to look, to work with hospitals on areas of cost management, whether it's procurement or efficient utilization of resources or people? Have you had an opportunity to look at that? And do you believe healthcare analytics can actually help hospitals drive down their operating costs?
We have worked in a very limited way on pure cost reduction projects. But yes, there's a large scope, and the scope is larger in spaces like diagnostics, where you have logistics problems being a primary problem. So that is a big area that I would see. And
maybe talking about our experience, I think there are specific areas in a hospital. Procurement is definitely one of the areas where just reasonably limited diagnostics can actually help you identify products that you want to use in given situations, your ability to negotiate better with the vendors given your requirement of the last few years. So definitely a big area where hospitals can look at price reduction.
Yeah, so there what our experience had been that there is a set of people in the hospital who knows the price is wrong, and they are the people who gained from the price being wrong, and they strongly oppose projects on that. Knowing the price versus being able to push through that project as an initiative for all purchases are two different things.
Perfect. I'm going to pose the last question to all of the members of the panel, and this is essentially to try and understand from you, if you were a decision maker, what would be your blueprint for healthcare analytics in the country? What do you think are initiatives which are required to both collect data, use it effectively for better outcomes in the country, better health outcomes, better prices, and better marketing and revenue for various hospitals? So just your blueprint for healthcare analytics, or implementing healthcare analytics, in fact.
So that's a question. I get a lot of WhatsApp jokes and forwards on what Modi should do and Kejriwal should do, and so the blueprint for the country is slightly large. What I would say is, what is the one takeaway that you can do?
Sure.
And what I would say is that whatever your top priorities and whatever results you're looking at, okay, just insist on data. Ask for data and insist on data. That's the simplest blueprint. More you have problems that you immediately need being fixed by analytics, the more cleaner the system will become.
Rahul.
So I think 3 bullet points. I think number 1, in everything that we do with respect to data, we need to keep the patient at the center and say that how does data analytics essentially help give a better outcome and a better care to the patient. So, keeping the patient at the center in all our decisions is important. Number 2, I think there needs to be trust amongst the stakeholders, providers, medical device companies, government, regulators, in terms of saying that this is very, very sensitive data, this is very, very sensitive information, so how do we really utilize in a manner to create more value rather than create some sensitivities around loss of patient information, etc., etc. And third, I think instead of boiling the ocean, we need to start off with few areas where we can see some quick wins and see some tangible results. So start off with some small pilots and then see the outcome of healthcare analytics getting delivered, create more confidence in the same, and then scale it forward to the next level.
Eve.
I don't know if I'm in the capacity to advise, but I think that large changes happen with a lot of small increments. And so if we could leverage mobile device technologies, which are accessible, affordable, and are going to be increasingly be pervasive to both healthcare system as well as consumer space. I think if you could leverage the mobile device technologies to implement some of the solutions like the folks like Vikram are developing, it would make it more participatory, and folks who want to take advantage of analytics can then participate, right? So whether it's a patient, whether it's a physician, or whether it's a CEO of a hospital, they can all start leveraging. Willingness is really a big part of it.
Sure.
I was at a hospital, I'm going to just go off on a 1-minute tangent. At a hospital with my father, which has a fantastically developed EMR system and one of the best hospitals in Mumbai. And the physician wrote everything on a piece of paper and then handed that piece of paper back to my dad. And so when my father walked out of the room, and I'm assuming that this doctor sees hundreds of people every day, he would not remember what my father's follow-up was going to be, and my father was asked to come back in some 4 weeks or 5 weeks. He'd have to repeat the entire story again, because that's the only way it works in India. You bring your records back and you recite the story to the doctor, and the doctor then has his amazing brain and he pulls everything out from there. So, and this is the hospital which had a fantastic EMR system. So if we had some more practical ways that, let's say my father input himself, and it's still painful, but he put his own stuff in this app that the doctor could then access. So I think that's the first step towards kind of democratizing healthcare analytics.
Sorry, Vikram wants to say something.
I'll add an interesting concept that got missed out. I think, I'm not sure it was covered in the diagnostics presentation also. Conventional belief in diagnostics has been that you kind of intervene in some way, maybe a blood or other sample collected, and that biomarker or other things becomes the basis for diagnosis. I want you to open and think that is there a possibility that you don't need to intervene at all, and using data and other footprints, which I call a digital biomarker or data biomarker, you can predict disease. And that's fundamentally what in healthcare analytics is an underexplored area, that can you catch some of the disease and others earlier based on data footprints that are there.
That, I think we will need another big session, right, to get into. Thank you, Vikram, for that. Input, maybe VC Circle can take that for the next conference. Just to quickly summarize, huge opportunities coming out of healthcare analytics, definitely supporting public policy. Healthcare analytics can be used for better medical outcomes for patients and also help in reducing cost both to the patient as well as to the provider. There are significant challenges, and I think the largest one is in terms of being able to capture data in formats that can be analyzed. Also some level of collaboration between the public sector and the private sector so that a lot of the information which is being collected today by hospitals, both the government and the private sector, none of the providers are willing to share, and rightly so. But we need some way of mechanism of collaboration so that we can get better trends in terms of the disease burden the country has, decision support systems that can be made post saying what has been the diagnosis, what are opportunities for treatment. Huge opportunities there, but again, significant challenges both on capture, data sharing, and then the analysis. I guess analysis is probably the easier one in terms of the challenges available. Thank you, gentlemen, for a very interesting conversation. I've learned a lot, and I'm hoping the audience would have learned something.